So I'm here today to talk to Dr. Bridget Walker about her best-selling book, Social Anxiety Relief for Teens. Dr. Walker, can you tell us a little bit about this book? Why did you write it?
I wrote it because in the teen years, the most common anxiety problem that we see is social anxiety, which is essentially simply an extreme fear of being judged negatively by others. It also includes things like fears of public speaking, doing things in front of others. Some people have a lot of anxiety talking on the phone. Some people have a lot of concern about doing basic behaviors like eating in front of others or texting in front of others. So there's variants of it, but it's common among adolescents, and we think 15% of teens suffer from diagnosable social anxiety disorder.
How do you tell the difference between normal teenage embarrassment and that self-consciousness that just comes with being a teenager and something that has sort of moved into the area of an anxiety disorder?
I mean, it's a matter of degree, right? We all care about what other people think of us, and we would all like to know that people like us or approve us. And, you know, if you think about it, when we evolved and we were cave people, you know, if we weren't included in a group, we would perish. So this is something that's highly valuable to us as human beings. And teens, you know, as they start to evolve away from their nuclear families and their peers become more important, they start to notice also that it matters what people think of me. And some teens have particularly intense fears of being judged. And so it's a matter of degree. And I'd say, again, going back to the 4Ds, why something becomes a disorder or when it becomes a disorder is if it causes a lot of disruption to a person's ability to do the normal things that they'd wish to do. Like if a kid doesn't go to dances or sporting events, or can't give an oral report, or refuses to take a class because it requires oral reports, or goes in the library every recess or lunch because they're afraid of making small talk, sitting on the bench or in the cafeteria. It's a matter of degree. So, you know, if a kid is avoiding doing that kind of stuff or doing them with an incredible amount of distress, that'd be a problem. If they're not doing it at all, that's disruptive. And if it goes on for a long time, at least 6 months, you know, that's when it becomes a problem. It's a matter of degree, really.
It's been all over the news that, you know, post-pandemic, there's been a real challenge for a lot of adolescents to re-enter school, to re-enter if they had a part-time job, regular social behavior.
Right.
We've certainly seen articles about it, and I think every person has an anecdote about some child who felt like they were thriving during lockdown. Have you seen this level of increase?
You know, that's an interesting question. You mentioned the kids who do better, you know, not in social situations. Well, it's because they're not in situations that trigger that anxiety. But when they go back to the context of school, their anxiety will come roaring back, probably many, many times worse. Because when you're in the environment, you have to face the situation every day. And your brain learns that it can handle it. When you're away from it, you lose that. And so you re-enter it, and it takes a while for your brain to relearn that, if you will. And if you have these predispositions and you have an intense reaction, sometimes that reaction within yourself is enough to be overwhelming.
So what can a teenager expect to find in this book?
Well, you could expect to find a lot of examples of different ways that social anxiety appears. I mean, there are some kids who might seem pretty gregarious, but you don't realize that they're rehearsing everything they say before they, you know, say anything, that they are only answering questions in class when they know that they're 100% correct. But so there's a lot of illustrations of the different ways that social anxiety can appear, and there's a step-by-step program whereby you can identify the behaviors that you're currently doing that are preventing you from learning, allowing your brain to learn that it can handle it, and you can gradually face the situations that triggered fear and anxiety in the book.
So I know your area of specialty is CBT therapy, something that stands for cognitive behavioral therapy. Can you tell the viewing audience a little bit about CBT therapy and why you're such a believer in it?
Cognitive therapy involves the thoughts that we have, and the thoughts that we have sometimes are very irrational and extreme, and some people are more prone to having those thoughts. And Aaron Beck, the creator of cognitive therapy, called them automatic thoughts, and he found that people have floods of them. And the problem with them is that we respond emotionally as if they are accurate. And so when we hold a thought, for example, that if I raise my hand in class and I am going to draw a blank, I'm going to believe it, and so I'm going to feel super stressed and anxious, and I might then do a behavior, here's the behavioral therapy part, where I avoid raising my hand. And then my parents hear from my teacher that I don't participate in class enough. And so the behaviors that we often do in response to anxiety, they sometimes work in the short run. Obviously, if you're never going to raise your hand, that's going to be a problem. But moreover, what we know is that when you avoid things or do other behaviors in response to anxiety, that actually feeds and maintains the anxiety and traps kids and adults alike in the cycle of anxiety. So one of the things that's great about these books is that, I walk a teen through, okay, well, how do I gradually face my fears? Like a common first exercise for a teen that would enable their brains to learn that they can handle certain situations would be maybe to make eye contact with people walking through the hall. And one teen might find that really difficult, but we might practice that. Then we might make eye contact and say, hey. And then we might gradually build to other things. So it walks them through gradually where to start, where they feel comfortable, to gradually expose themselves and put themselves in those situations so they can learn that they can handle it. And that's essentially the most important part of CBT as it relates to anxiety disorders is exposures, yeah.
And so do you feel like this is something teenagers can learn rapidly and put into practice right away?
Oh yeah, I mean, I've had kids who get it and they are, done with me in 4 sessions. I mean, really, they run with it, especially kids who are mentally disciplined and motivated. They get the model and they get better really quickly. Others have a harder time. Everyone's a little different.
Yep. So is this a resource that would be appropriate for a parent of a teenager or even a teacher?
I think so, because if you can put yourself in someone's shoes and understand what they're going through, that, this book will help you do that. But also, you will then know, what behaviors your kid is engaging in that really aren't helpful, and you can sort of coach them or reward them for, well, hey, I'll go get a pedicure or manicure with you if you go to this party. And rewards really work to motivate kids. So you can sort of help them along and, in fact, do it together.
One of the things I like, actually, just looking at the cover and listening to you talk about it, there's a normalizing of what I think is such a rampant issue, right? And I have to imagine with teenagers who are so acutely self-conscious, there's probably this feeling like I'm the only person with this stigma, right? So is part of your work to destigmatize mental health issues?
Well, absolutely, and I will tell you that sometimes parents are like, well, don't use a diagnosis, and because that's going to make my child feel like they have a problem. Well, the truth is, most kids are relieved because they know that it's something that other people suffer from and that we know how to treat. So it's very rare that a kid will have a problem with that, and also I'll talk to them about how many other kids suffer from similar issues, and oftentimes I'll share anecdotes without obviously giving identifying information, but they're having to go through this, so they appreciate knowing that they're not the only ones and that we know how to deal with these things, yeah.
Well, it sounds like a fantastic resource. I imagine it's available on Amazon.com.
It is.
And in your local bookstores.
Yeah.
So thank you so much, Dr. Walker. I can't wait to get my hands on a copy.
My pleasure.